Governor Dan McKee is trying to create a new early warning mechanism to prevent the sudden closure of medical providers. Thank you for joining us on this Good Friday. I'm Mike Montecalvo. This comes as around 25,000 Anchor medical patients try to find a new doctor before they close their doors this summer. 12 News reporter Alex Torres-Perez goes over how some providers are stepping up to help these Anchor medical patients and what they think about the governor's plan. Alex?
Well, Mike, several Anchor medical patients tell me they're facing a months-long waiting list to try to get a new doctor. But some medical providers say their doors are open to help out those patients who are being left without primary care. Over 1,500 patients and counting are making the switch to Arches Medical. That's after their primary care provider, Anchor Medical Associates, announced it would be closing its doors this summer because of the high cost and low reimbursement rates. Something Arches medical physician Gregory Allen says offices across the state are also struggling with.
Rhode Island's been behind the 8 ball for a while with respect to primary care reimbursement. It's difficult to recruit and retain physicians in this state when you're really, 10, 15, 20% behind some of your local neighbors in Connecticut, Massachusetts, New Hampshire. To avoid any other sudden closures, Governor Dan McKee submitted a budget amendment Friday. It would require medical providers to submit quarterly financial reports to the state. That way, the state can identify any potential financial risks and step in early to avoid any layoffs or closures. The Secretary of the Executive Office of Health and Human Services saying, quote, "We owe it to the people of Rhode Island to protect their health care access, and that starts with understanding where risks lie and addressing them before it's too late." But Allen says it's not enough. I think what would be most helpful is if there could be some support for primary care in the state. Direct support. In the meantime, his focus is on helping those Anchor medical patients looking for a new doctor. We're trying to do the best we can to help local people.
And Governor Dan McKee's budget does ask for a review of those reimbursement rates. If passed, that review would be due in late 2027 and not take effect until 2028. On Newsmakers Today, the vice president and past president of the Rhode Island Medical Society said they have the data and wanted action to be taken now before the crisis gets worse. Reporting in studio, I'm Alex Torres-Perez, 12 News.